Hi, I'm Greg Feld, Director of Public Health. This is a COVID update for 29th of April, but we'll do epidemiology first. Consistently falling. We're well over the peak of the Omicron wave now, so rates across the country and in Yorkshire are consistently falling. So still causing problems, still plenty of people pretty poorly actually. Quite a few people I know are quite poorly at the moment, so anyone who thinks COVID is over, you are sadly mistaken. It's still around, it's going to be around for an awful long time to come yet, but the wave that we've seen is waning now and will continue to wave into the summer. I wouldn't predict what will happen beyond summer. The significant number of people who are not vaccinated still, and COVID will find them. So the single most important thing that we can all do to protect ourselves if you're not yet vaccinated is be vaccinated. So my thoughts and worries going into the future, protection from vaccination will wane. Will it wane faster in some groups than others? We genuinely don't know that yet. That's at the cutting edge of the science, and we're watching that one carefully. Reinfection is a problem. There are plenty of people who've been infected 2, 3 and more times with COVID, and that's going to be an issue. There will be more variants. There'll be further wave of COVID at some point in the future. It's undoubtable. How we respond to that nationally remains to be seen. There will be variants. There's BA4 and BA5 are around at the moment. They're not yet in the UK. I don't know whether or not they will get to the UK. But it is a risk for the future. So the what can you do to protect yourself, sadly, is a very unchanging list of stuff. You've heard me drone on about it before. Wearing a mask continues to work. Vaccination has saved countless lives in the city, continues to do so. Washing your hands, again, has made a difference. Don't spread your respiratory bugs. If you are poorly, don't spread your bugs to others. And I think the culture on that has changed a little bit over the last year, actually. Information on all things to do with protecting yourself against COVID and what to do if you develop symptoms is on our COVID pages at the end of this video. So this week is World Immunisation Week. It's also known as European Immunisation Week, and I take this opportunity to promote that vaccines save lives. It's a core, critical part of public health interventions, and absolutely vital to preventing diseases and protecting lives. There are plenty of vaccines for vaccine-preventable diseases that save lives, undoubtedly. So we want to increase vaccination coverage by raising awareness of the importance of it amongst parents, caregivers and healthcare professionals. And as I say, there are plenty of vaccines that genuinely do save lives. Under 5 preschool vaccinations are crucial for protecting children. They help make sure the children are ready for school and protected against childhood diseases which are easily spread in a school environment. One of the things that's flashing really quite red on my risk radar at the moment is there's a drop-off in the number of people who are getting to age 5 and haven't had all of their early childhood vaccinations, and that's a really significant issue. We're treating it very, very seriously. So when you're contacted, please do make sure that you book, and if you're unsure of your children's vaccination status and whether it's up to date, then please contact your GP. The adolescent immunisation programme in schools are delivered by the Children's Hospital team, and there's some very experienced and very well trained 0 to 19 school nurses. These are delivered in secondary schools throughout the year. There's a rolling programme through the year, and adolescent immunisations provide important protection against a range of diseases, including meningitis, diphtheria, polio and tetanus. Lastly, the other vaccination that's given to teenagers is HPV, human papillomavirus. Vaccination, which is delivered to teenagers. Recent evidence published in The Lancet 2 or 3 months ago showed that the vaccination is hugely effective, beyond our hopes actually, for preventing cervical cancer. So again, we've been vaccinating teenagers against HPV for quite some time now. We'll continue to do that, and please look out for information being sent out by your school so your child can be protected.